Constipation affects millions of people worldwide who suffer from their quality of life and general health. Symptoms, causes, and how to prevent it. In this video, we explain scientifically proven methods to avoid constipation for an optimal digestive health. Constipation is much more than just an annoying issue, but something that can genuinely affect the way you live your everyday life and overall health. Besides the inconvenience of extended constipation, there exists a heightened potential for more serious health concerns, for example, anal fissures and rectal prolapse. Early intervention to correct this condition through preventive measures is crucial for the maintenance of long-term health. Furthermore, this one single disease carries huge economic repercussions with the direct and indirect costs to individuals and systems, from health expenditure or lost productivity. And tackling constipation should also become more proactive as these fruits of the scientific enterprise ripen, once again measurably easing health and economic burdens. But first, a quick reminder. All content is for informational purposes only and should not be construed as medical advice. Always speak to a healthcare professional before introducing changes to your diet or lifestyle, as some health circumstances and drug interactions could be impacted. Constipation symptoms and causes. Bowel movements normally occur almost regularly, but in the circumstance of constipation could be less than 3 times a week. Other manifestation may include this: difficulty stooling or incomplete bowel emptying, poor diet, not enough water, no physical exercise, all common culprits as well as medications. Unresolved chronic constipation turns into a medical emergency when complication like fecal impaction, where bowel movements remedy is not possible unless surgery or endoscopical therapy is done. Because constipation is very much affected by individual differences in physiology, from bacteria to lifestyle choices, constipated behaviors can look vastly different from one person to the next. While there are some people who by nature pass less stool, it becomes worrisome when bowel habits have drastically changed or if eliminating waste causes a lot of pain or discomfort. It's shown to emphasize the significance of understanding your baseline and being able to identify when things are off, sometimes pointing to an underlying condition. Environment and what you do also have the activities being symptom of constipation. Factors such as stress, changes in routine or diet, travel, and even weather can all have an impact on regularity of the bowels. Furthermore, certain supplements and a diet loaded with processed foods can make things even worse, making it clear that the key to preventing and managing constipation lies in adopting an holistic approach through your food and lifestyle if you want to combat constipation effectively. 12 tips to avoid constipation. The prevention of constipation that can be most effective involves changes in diet, lifestyle, and sometimes medications. So here are 12 science-based tips. 1. Probiotic-rich foods. Foods such as yogurt, kefir, sauerkraut. Research suggests probiotics help maintain a healthy balance of gut flora, supporting bowel regularity, thus helping to achieve a flat tummy. This balance is essential not just for regular bowel movements, but also overall immune efficiency and nutrient assimilation. Eating foods containing high amounts of probiotics can contribute to a healthy and better digestive system. Other research shows that certain strains of probiotics like lactobacillus and bifidobacterium, which are found in fermented foods, significantly improve the stool frequency and consistency among participants suffering from constipation due to its function on intestinal transit time. Including these foods on a daily basis will help in generating an ideal gut environment for proper bowel habits. 2. Vagus nerve stimulation. More defined techniques such as deep breathing to gargling can stimulate the carrier of our gut input and improve bowel motility. The vagus nerve is a critical part of the parasympathetic nervous system, which controls our ability to relax and digest. As advocated by scientists for so long, triggering this nerve in certain ways improves the efficiency of digestion and is a natural way to tickle brain-heart connection stress decrementing, and anxiety busting too. This direct effect on the gut enables it to move in a more regular rhythm and thus pass stool better, making this a fantastic way to help relieve constipation. Other ways to activate the vagus nerve is through humming, singing, or even laughing. By relaxing and supporting the body every day, we keep a healthy gut that thrives without inflammation. The more consistent you are with activities like these, the less invasive and enjoyable they can be as a means of maintaining digestive health and preventing constipation. 3. Mineralized water. Because mineralized water provides magnesium, the other essential minerals such as calcium and even potassium that are often present in mineral waters become important parts of your daily macronutrient intake, which enhances fluid balance maintenance as well as overall digestive health. Regular consumption of this water is vital to ensure that the body gets a variety of minerals in the amounts required to support muscle contraction and nerve function, which are all important for bowel health. Not only does it help the digestive process, but the perfect blend of minerals present in natural mineral waters may have a certain specific inter-individual health benefits. Example is magnesium relax muscle in the intestinal walls that allows an increased peristalsis. They are wave-like movement push the food through the digestive tract. Knowing the food that are eating and how to prepare them is crucial for us in reducing chances of constipation and facilitating easy movement of waste throughout our colon. 4. Castor oil packs. When used as a pack, the oil absorbs into the skin and into lymphatic circulation, helping to clean out our detox pathways, supporting liver function, reducing pain, opening up lymphatics, allowing us to clear toxins from the body. Applying a warm castor oil pack on the abdomen is especially helpful, as it both loosens stool and possibly benefits prompt muscles in the intestines. 5. Avoid snacks. Trying not to snack too much can allow your digestive system to properly process meals, which helps with keeping you regular. Eating all the time has a tendency to keep your digestion in a state of constant activity, which can efface your natural waves of digestion and absorption. Digestive system. When meal intervals are longer, the digestive organs can carry out their processes in greater efficiency. This not only aids in better nutrient absorption, but also helps to prevent constipation by keeping waste materials dense and ready for elimination. Additionally, decreasing snacking habits, which leads to better hunger signals throughout metabolic health. The body learns how and when to release digestive enzymes and stomach acids, which allows the food to be digested in more of an even pace. This can help regulate the bowel movements and stop things like bloat and backups from taking place frequently. 6. Digestive bitters. Taking bitters before meals can stimulate the digestive organs to produce digestive enzymes, bile, and stomach acid. Digestive bitters also work to activate the bitter receptors on the tongue, which send signals to the brain that it's time for digestion. In addition, the regular use of digestive bitters can help keep your gut flora in balance by increasing stomach acid, which kills pathogenic organisms before they can pose a problem. 7. Physically lack. Regular movement, simple walking, may be better adherence than anything on your frisk of ingredients. Unsurprisingly, in our sedentary Western society, regular exercise is associated with much more than just good cardiovascular fitness. The intestines also absorb and process food quickly and efficiently. The additional blood flow and muscle moving around the intestines during physical activity makes this happen. Show love to your intestines' postal system. Even light exercise, such as taking a casual walk throughout the day, get things moving, especially peristalsis, which are muscle contractions in the walls of the intestines that move their contents through them. Not to mention the regular physical activity which helps in toning up loose abdominal muscles that are key for proper bowel motility. Abdominal strength. The abdomen is supported by burpees, allowing the intestines to function more mechanically during bowel movements. This can not only help to avoid constipation, but also reduce the strain needed to pass bowel motions, so you are less likely to develop conditions like piles or anal fissures due to straining. 8. Yoga squat. When you do yoga squats, it can help your bowels to move more gradually by aligning the intestines correctly. One of the reasons it outperforms conventional sitting is that you achieve a figure 4 by simply bottoming out just before where you would begin to hunch forward when using a squatting toilet. This anatomical change helps create a more streamlined passageway for stool to travel through, which is especially helpful for those who have chronic constipation. The squat position, an individual pose using the toilet, really should be what nature created us to use, and is backed by either natural and recent health process. Daily squatting with yoga can also be incredibly useful for men, improving pelvic muscle strength, flexibility, and circulation to the pelvis and digestive organs. Improved blood circulation also means more oxygen and nutrients delivered to your organs, benefits healthy tissues and the functional capacity of digestive organs. Hence, regularly practicing the yoga squats not only help to provide instantly relief in moving bowels, but contribute as a long-term digestive health. 9. Robust circadian rhythm. Regular sleep supports a healthy circadian rhythm which has beneficial effects on the gut. Many gastrointestinal disturbances, such as constipation, are involved in sleep disorders related to the circadian rhythm. The body's internal clock determines when the stomach empties and enzymes are released for digestion, so its role in bathroom habits is important. And a properly regulated circadian rhythm helps keep gut microbiota in check, which is also very important for digestive health. Studies have shown that, in the same way it disrupts healthy signaling from the gut to the brain, a malfunctioning circadian clock can also create an imbalance of these gut bacteria, which further contribute to symptoms such as constipation, seen with non-24 sleep-wake disorder. One of the simplest and easiest ways in which you can maintain good digestion states is by making sure that you are getting enough sleep on a regular basis. 10. Squatty potty. By lifting your knees above the hips using a squatty potty, you place yourself in an ideal squat position for optimal colon alignment during defecation. The inspiration behind the design of the squatty potty is something we did for centuries: squatting during elimination. Toilet paradox. The plumb angle created by modern toilet, while comfortable, actually compresses the intestine. Bending body in this position will constrict your colon muscles, making it harder to eliminate. This is corrected by raising the feet. Squatty potty has an excellent toilet stool, which relaxes the puborectalis muscle, the muscle responsible for choking your colon like a stack of Lincoln logs to keep you continent. This relaxation produces a similar effect to a straighter channel, which in turn makes the action of defecation simpler and less likely to strain or become constipated. 11. Relieving trauma. Emotional stress may cause digestive harm. For example, emotional blockages and their influences on the intestinal tract can be neutralized with therapies like cognitive behavior therapy or also by meditation. Mental health and physical well-being are closely related, with the gut representing one of the most sensitive systems when it comes to volatility and emotion. Long-term emotional stress can create an autonomic imbalance in the brain, causing varying components of your autonomic nervous system, the part that tells your gut how quickly it should run, to not work together. Dealing with and release emotional pain can help bring back natural digestive rhythms in the body, which will not only reduce constipation but also healthier digestion. Strategies like mindfulness meditation, guided imagery, or cognitive behavioral therapy, CBT, can be especially helpful in moderating stress and its effects on the gut. It is also one of the ways we apply non-sensory strategies to help us relax and stay awake, especially when dealing with unresolved trauma or stress that could lead to a fight or flight response. When practiced consistently, these techniques also have long-term benefits in terms of gut motility and function, which helps reduce the risk of constipation and support the body's ability to digest and clear waste effectively. 12. Acupressure. Stimulation of digestion and relief of constipation through applying pressure to specific points on your body. Acupressure, one ancient art that lies in traditional Chinese medicine, which base on the grounds of meridians within the body. Acupressure releases blocked energy, or qi, along the meridians in the body by applying pressure to trigger points along these meridians to provide balance among the body's systems. Points that help support digestive function, such as the pericardium point, PC6, located on the wrist, or stomach point, ST36, located on the leg, are especially useful for boosting intestinal activity and promoting good bowel movements. Moreover, frequent acupressure treatment also helps to prevent the slowdown of the digestive tract, which is attributed as one causative factor to induce chronic constipation, frequently due to an ill adaptation of stressed individuals. It normalizes the hormone levels that control gut motility by reducing stress and anxiety. Frequently asked questions. Constipation-type issues seem to be a common concern for many viewers. Here we are going to cover these few points with expert tips. What simple trick empties your bowels immediately? A brisk walk, then sipping on warm water, moves your bowels fast. A second method that can also work is to give the belly a gentle clockwise massage, going in line with how the colon flows. This can support peristalsis, the muscle facilitation which guides stool by using bowel tract to encourage intestinal movements. One of the same G5 massage you can do on your belly combines with deep breathing to further accentuate it, but all over this routine works stuffs to fix constipation in a very easy and quick way. How to know if constipated. Symptoms involve less than 3 bowel movements per week, hard or lumpy stools, and difficult or painful evacuation. Feeling of incomplete evacuation. Even after pooping, it indicates that you might be constipated, as it means even after opening your bowel, somewhere within you feel something still there inside the gut that didn't pass. It can be associated with some bloating or abdominal discomfort, as well as decreased frequency and ease of passing stool than you normally would. Recognizing these changes can help you catch constipation before it becomes a problem. How to unblock bowels at home. Having warm water at regular intervals, eating high-fiber foods, and consuming over-the-counter laxatives could be helpful. But if the problem remains, then you should consult a doctor. You can also try to use natural stool softeners, such as prunes or prune juice, which are very high in sorbitol, a sugar alcohol that can attract water into the intestines, making passing stool easier. Moreover, simple physical activities, such as yoga and stretching exercise, can make your bowel moving. But when none of these methods can solve the problem, we need to see a doctor to rule out any underlying problems. What to do if hard poop is stuck? A warm bath may help to relax the muscles and make it easier to pass stool. If not successful, a mild laxative or enema may be required under medical guidance. If potty training has just begun and you notice that your child is struggling to poop, you might want to fill the tub with warm water, which could also be soothing. Or apply an ointment like petroleum jelly or coconut oil around her anus to smooth out the passage. You could even drink a warm beverage such as herbal tea or hot water with lemon, which may help stimulate the bowels. If you are still finding it hard to perform, it is important not to push yourself too much, as this can lead to other problems. Alternatively, you can try a gentle stool softener or glycerin suppository, but be sure to always speak with your healthcare provider if you are unsure and the problem is ongoing. If you find these tips helpful, be sure to give this video a thumbs up, hit the subscribe button, and turn on those notifications so you can stay up to date. Share your stories or more questions in the comments to benefit others in our community. Your support helps our mission to provide the most accurate and up-to-date information to help you live your healthiest life. Thank you for watching.